Type 2 diabetes, is it a fact or a fiction that you can actually reverse it? The good news is it is 1000% a fact. You can actually reverse diabetes. But let's talk about the reasons why so many people are being told that you can't reverse diabetes, that there's no options, that the best you can do is manage your diabetes. The big picture is that most people believe the only option to take care of diabetes is to manage it. So we have to understand the differences between why it's considered managed lifestyles or managed diabetes compared to actually truly reversing diabetes. And we'll actually define that as well today. So the first thing we have to look at here is we have to decide which model are we going to be actually looking into. You see, we have the medical model versus the functional medicine model. And these are two different models that actually identify and address type 2 diabetes. They're very specific in the way they do things. So let's look at each one of them and the specifics of what they're trying to achieve when they're trying to either manage or what we do specifically in functional medicine, reverse diabetes, and how that's even possible. In regards to the medical model, we are focusing on a couple things. First thing is, the recommendation is to change your diets, right? You go in to see your doctor, they say the first thing you have to do, you have to start eating better. Currently, you're not eating well. Let's start changing the way you eat. It's a very common thing you get. The second one is exercise, right? If you're not exercising, start increasing your exercise. That could be as little as walking for 20 to 30 minutes a day, increasing strenuous activities like weightlifting. Any kind of activity you can start doing, they're gonna recommend as an option for treating your diabetes. The third one is lose weight. Many individuals who are dealing with diabetes, they need to lose some additional weight. They have some additional pounds on, and by reducing that weight will actually help their blood sugars. The last one is medications. This is the most common one that's given to type 2 diabetics, as individuals are going to be using pharmaceutical drugs that are very common. Things like metformin, glipizide, Januvia, Ozempic, these GLP-1s that are very common these days. These medications will be used in conjunction with the other areas. So here's how it looks. You go see your doctor, you're diagnosed as a type 2 diabetic, you're told, okay, here's what we have to do. We're going to have you change your diet, lose some weight, start exercising, and of course, start taking your medications. And then you're left to leaving your doctor's office, trying to figure this out on your own. And essentially, that's going to be the extent of working on your diabetes. Now, the question is, does this actually reverse type 2 diabetes? Well, the stats are very clear. What the stats tell us is less than 1% of individuals who follow this recommendation will actually reverse diabetes. Well, what does reversing diabetes even mean? Let's define that. Reversing diabetes means you're getting off medications. You're regulating your own blood sugars without the use of extreme diets or exercise or weight loss routines type of thing. So this is what your body's actually doing on its own. Because remember, at one time in your life, you were able to manage your own blood sugars on its own. So something must be off. And unfortunately, in the medical model, when you follow these recommendations, less than 1% of the individuals will actually reverse their diabetes, meaning lower blood sugars, a normal A1C, off medications, etc. And why is that? Because these do not address the underlying cause of why you have diabetes. And this is where it comes into play when you look at the functional medicine model. If we look at the functional medicine model, we can go a little deeper in this situation because the functional medicine model focuses on very specifics. We do comprehensive testing. We evaluate you very comprehensively to identify what problems are going on that are contributing to why you have diabetes in the first place. Remember, there's a reason why you're diabetic. It's not because of the way you've been eating or your lack of exercise or weight. Because if that were the case, then that other model would have a very high success rate of reversing diabetes, which we see being very low. As I mentioned, less than 1% of the population will actually reverse their diabetes following the medical traditional model. The next thing under functional medicine is we identify the root cause. This is massive. But if you understand diabetes, it has nothing to do with your sugars. This is very important. Many people believe that it's elevated sugars that is causing their diabetes to get worse. That is not the case. Diabetes is a cellular disease, right? You probably have heard the term insulin resistance. Well, that's what cellular disease means. And if you want to learn more about how we help individuals with this type of condition, make sure you download my guide. It has a lot of information in there. Click the link, download that guide. It'll be very beneficial for you. But we have to identify the root cause of why you have diabetes. And here's a little trick. The root cause of your diabetes is going to be unique to you. It will not be the same as someone else. So if you have 5 people in your family, all with diabetes, and you're being told it's because of your genetics, that's not the case. Each and every single one of you has a different, unique reason for why you have diabetes. So you have to identify that. And how do we identify it? Through comprehensive testing. So once we identify the root cause, then we can create a customized solution. The good news is it doesn't require extreme diets. It doesn't require extreme weight loss or even extreme exercise either. There are very simple techniques that can be done. Will it require some lifestyle changes? Of course it will. You're not going to be able to go eat McDonald's every single day. That's not going to happen, but there will be some recommendations and very easy holistic protocols. No extreme medications. We can use things like supplements, herbs, and nutraceuticals to address the cause, not your sugars. We're not talking about taking supplements to lower the sugars, but to address the cause of your diabetic condition from the testing itself. So we identify what that problem is specifically. Then after we create that solution and you get to a point where you're showing no signs of diabetes, this is possible, guys. We see this all the time where individuals have a diagnosis and the next thing you know, their A1C is normal, their blood sugars are normal, and all the other physiological changes are in a normal range again. This is possible once you identify and you create a customized solution. Once that solution is completed, now we have to maintain it. There's no reason for you to do all this work and just say, oh, I'm gonna go back to my old lifestyle habits. If that's what you're thinking, this is not the approach for you. You have to close those doors, right? Never go back and create a new path. And this new path is going to guide you into longevity, help you stay healthy for a very long time so you're not having to worry about this roller coaster ride of what's currently going on in the traditional medical model where your blood sugars are going up, they're going down, we're increasing medications, we're decreasing medications, we're adding additional medications, and we're getting sicker and sicker as the progression of diabetes continues. So it's very simple. Our focus in the medical model is to manage diabetes, right? You've probably heard this before. What does managing diabetes even mean? It means that we're trying to keep your blood sugars at bay. Does that require 2 medications, 3 medications, 4 medications, even insulin potentially in some cases? That's okay because our goal is to manage this. Versus functional medicine is a long-term solution where the need for medications are no longer necessary because your body has the ability to do this. Remember one thing, if you get nothing else from this video, one thing, your body is the smartest doctor you're ever going to come in contact with. The ability for your body to heal is the highest level that we've ever seen. The problem is that things start blocking the ability for you to have that healing. Once we unleash that and your body can start healing again, that's how we reverse. So if you remove all the problems that are contributing to why you have diabetes and you start helping the body to heal, you can create a long-term solution. So this is not just a quick fix. This is helping the individual get to a place where they can maintain this on their own for the rest of your life. So if we go back to the beginning here, type 2 diabetes, can you reverse it? Is it a fact or is it fiction? It's 100%, guys, a fact. You can absolutely reverse diabetes if you know the right steps. If you want to learn more about how we help individuals reverse diabetes and go through all the steps, all the type of testing and things that we do, make sure you watch this video right here because I will be going into more detail of specifics of how we do that. All right, we'll talk to you soon.